Hi, this is Brandy Shantz, and you're listening to Living Chronic. Today I'm here with Dr. Debra Stroiney, Associate Professor, George Mason University, Professor of Exercise Science. Welcome and thank you for being here.
Hi, it's good to be here.
So I'm really excited to have you here today because you are Professor of Exercise Science. And I've always said that I felt that my diagnosis took so long uh, because I didn't know how to communicate to doctors what I was feeling other than to say I felt like I was in overtraining syndrome. And of course, the doctors have no exercise science background at all. So when I said I feel like I'm in overtraining syndrome, they would say, "Well, what does that mean?" And then I would have to explain that. And I think my fitness levels plus them not understanding exercise science is really what delayed, or at least it helped to enable that delay in my actual diagnosis. And this is your field. You talk about, exercise is medicine. How do you think that exercise science knowledge among the doctors may have changed my outcomes and diagnosis?
Um, it is, and I'll recognize that it's tough, right? Because physicians not only, right, are they going to medical school, but then they're going to have their specialty, and even their research is usually going to be in that specialty. So even if you take exercise out of it, and when you go to a general specialist, you might have hypothyroidism, and then but their like specialty and their research is in diabetes, right? So, they're supposed to be kind of knowledgeable in everything. So I do understand their struggle, but I do believe that there is some room for physicians to get a little bit more exposure to what's happening in the body during exercise. And they do, from what I've heard. But it is very much an abbreviated version of that. The American College of Sports Medicine does have a program where they do reach out to physicians and try to get them more educated and work with physicians
Mhm.
on trying to promote exercise in not only just in the general population, but in special populations like those with chronic disease. So, and it's hard to say from case to case, right? Um, if they had been a little bit more knowledgeable about exercise and maybe like knowing your training or knowing some of the typical responses to exercise and adaptations that occur, which they should, they might have seen maybe a red flag sooner,
Mhm.
that it wasn't just overtraining. And I think this will go back to what, in general, I think that we all know that we tend to have like now a team that helps us. Whether you're an athlete and you have your massage therapist and your chiropractor and your general practitioner, or if you have a chronic disease and you're like, well, this person's treating this side and this person's treating this complication. So I think we're going to start to see more of that team aspect. And I really
Mhm.
hope they push towards that, because then if the doctor said, you know what, this is not my area, but let me refer you to this specialist, let me refer you to this behavior change coach, let me refer you to this exercise physiologist that I know, and they can do some assessments on you as well to determine, is this something medical or is it something more related to overtraining, right?
Mhm.
So I think that's where we need to go, is even if they can't be as well versed in it because they don't have the time or capacity, then they need to have a team that they can work with where they can refer you out. So,
Mhm. So I really love how you speak about exercise as medicine. I've always felt that in a way because I have been an athlete my entire life. And I always want to emphasize, while I have bemoaned the fact that it did take so long for me to be diagnosed, and I think part of that was because I was so fit. I think it's very important to note that I withstood a lot of severe um, and traumatic things happening to my body because I was fit. And once I did get off the medication and we did identify it as drug induced lupus, and I started working with a physical therapist because I had lost my ability to walk, that side of the house, was very aware of the fact that not only did I get back to walking quickly, but I got back to running quickly because I was so fit. And had I not been, I might have still been learning how to walk again 6 months later. So, with that in mind, how do you see exercise as benefiting chronically ill patients? And how can it help us in our day to day lives?
And one of the things you already just said is that if you are more physically fit going into a chronic disease, the symptoms are going to be lesser. You're going to regain strength. You're going to bounce back sooner than someone who is less physically fit. And we're already starting to see that. Like we can even use like the COVID pandemic as an example, right? Like the individuals who are obese have cardiovascular disease because likely due to inactivity, because sometimes it's genetic, but likely due to inactivity, those were the individuals who had the most complications, right?
Hmm.
Um, Individuals, again, even for people I've seen who have genetic cardiovascular disease, that genetically they have a family history of heart disease. And those individuals, though, even if they have a heart attack, if they have bypass surgery, they have bounced back sooner than those who didn't. So that's one right there. And I mean, that'll be a case by case and how severe, but it's definitely seen that recovery. But just in general, I'll start with the one that I think everybody will appreciate the most is the quality of life.
Yes.
Being able to not be so debilitated that you can't do normal activities of daily living or things that you enjoy. Your friends ask you to go on this walk or a trip or even out to something that's more physically active. It's enjoying those things that make us happy. And so I think we get worried, like when, again, like you can't perform just normal activities, daily living, it, it affects us a lot. So just in general, there's studies out there and you can all go and just Google search quality of life and like chronic disease like lupus or Crohn's or multiple sclerosis. And there is now documented research done by scientists that say quality of life improved in these patients when they went through an exercise program. And I don't even want to say exercise program. We can talk a little bit more later by how little you need to be physically active to get those
Mhm.
benefits of quality of life. Some of the other areas that it helps is with a lot of chronic diseases, you have those other complications.
Yes.
So, cardiovascular issues, bone density issues,
Hmm.
inflammation, muscle loss. Exercise is going to help with that. So, I just looked at an article that with Crohn's disease, in those individuals, you're going to have a higher risk of osteoporosis.
Yes.
And so, if you're maintaining a physical activity program and getting physical activity, you will likely prevent some of those severe osteoporosis symptoms and risk factors because exercise is allowing the bones to maintain
Hmm.
with the weight bearing activity. So, whether it's walking or resistance training or any other weight bearing activity, you'll get benefits and prevent bone loss.
Yes.
And bone loss is not, you can't reverse that. So we grow bone mass up to a certain point in our life, and then the rest of that point is for us to maintain it.
Yep.
So we want to maintain it. So the exercise will help with that. A lot of the medications you take cause weight gain. Um,
Hmm.
and I mean, this is across the board. With any chronic disease, you're going to have those side effects from medication, and usually exercise can offset some of that. That's tough though because that weight gain is from the medication.
It is, and
It's
an
from
exercise
that.
that could get rid of moon phase. I'm just
Yeah.
saying. If we
Yeah.
could find an exercise to get rid of the moon phase, I'd be very happy.
And that's the thing is like you don't want to focus on that so much because they're part of it. There's nothing you can do,
Right.
but so that you don't get that excessive gain,
Yeah.
exercise will offset some of it, right?
Um,
So if you already have that weight gain from the medication, but then you're also sedentary, then you're going to have the weight gain from being sedentary, and then they're going to compile onto each
it,
other.
and
So
it happens fast too.
yes, yeah,
I have learned that the hard way from not, from the times when I haven't been able to be
yep.
active because the Crohn's is so severe or because I'm suffering from drug induced lupus. Yeah, it happens fast because the first thing they do when something's wrong is they think prednisone.
Yeah.
And I'm like, but I can't move.
Yeah. And that's the other part though is I'm saying this, but I do recognize the fact that if it's painful to move, if you have fatigue, if you're tired, I know you have to fight through that. But
It is.
just knowing fighting through that on the other end, you will feel better. So that's another thing. It helps with the fatigue and it helps with the depression. It helps with the anxiety. It helps, like you were saying, just like I feel like I can't move. I'm stiff. Again, just like light yoga and stretching or
Mhm.
like just easy movements can help with some of those symptoms as well.
They do, and I do yoga twice a week, and it's helped me with my movement and balance quite a bit.
Yeah.
Yep.
And even something like multiple sclerosis, which again, currently not reversible. Your so the myelin sheath on the axons are degrading, meaning
Hmm.
conduction of the signals is not going to be as great on your nerves, right? So that can manifest in so many different ways. But so much more research now coming out on how exercise can slow that down.
Yes.
I've talked with I knew an athlete who has MS and she was cycling and she's not like a it's not like a pro cyclist. She's just average
Hmm.
ordinary individual and would cycle 3 or 4 times a week and her doctor said, "I don't need to up your medication because you've been exercising."
That's outstanding.
So, and then if you look in the research out there that's out there, that's what they're starting to see is pushing that off. And again, we'll talk about this later too, but you just have to match where you're at. So maybe water aerobics is better for somebody because it will take some of that pain and stress off the joints that they feel while
Hmm.
they're exercising.
And I think that can be very difficult. One thing I've noticed, and of course, we all have a different perspective we're coming from. For people like me, it's very difficult to meet myself where I'm at because I want to do Ironman Chattanooga
Yeah.
and I want to finish in the top. So having to dial all that back and find something that's more appropriate for right now, like yoga twice a week or swimming because it's easier
Hmm.
on my joints, it's very difficult. And I have to say, the other thing I've noticed since going through all of this that never would have occurred to me before is I wish that there was an app that we could put out there to help us to better quantify what we should be doing. Because everything in the exercise world out there, for the most part, is encouraging you to go harder, go
Yeah.
longer, go faster, motivate. And I don't need motivation. I need somebody to say, go slower, go less, child. Yeah.
Yep.
And we just don't have a lot of that. I'd actually joined Orange Theory this year just because I was having a lot of anxiety around exercising since
Hmm.
for 2 years almost every time I exercised or at least made an attempt, I was down for the count for 3 or 4 days. It would just wreck me. So I was starting to associate exercise with pain and making my condition worse. So I thought, well, maybe I'll have fewer panic attacks if there's people around me. But I had to have a conversation with the coaches because they'd be like, push it harder. And I'm like, no, we're trying not to die today.
Yeah.
I'm in
Yeah.
pain, or they say, you have to, extend your joint all the way out. And I'd say, it doesn't go there right now. So I do wish that there was something out there to help, chronically ill people to say, you know what, this is okay for today.
And I don't know if there'll be an app. I should look into that, but um, you can definitely because of the way our fitness industry and coaches and everyone has evolved, you have to dig a little bit.
Yes.
So I would encourage anyone listening to this that if you have a chronic disease or you're definitely someone you're not ready to go to that, like again, Orange Theory or an intense exercise class, is to research some trainers or coaches out there who specialize in that area. So, for instance, like cardiac rehab, that's like, and one of the articles I read was, it was a perfect example that there's so much research on cardiac rehab and quality of life and things like that, and there's less on Crohn's, lupus,
Hmm.
multiple sclerosis, right? And I think that's just because in general they've had a hard time figuring out what does this disease mean, and there's so many systems that it involves. So cardiac rehab, that's easy. You can find somebody who is an clinical exercise physiologist who works in cardiac rehab to say,
Hmm.
oh, you've just had heart surgery.
Hmm.
Here's how I'm going to progress your exercise program. Harder to find in some of the other chronic diseases. So I think you just have to dig and see and interview people and ask them, like, do you know how to coach somebody who has this illness? Again, in American College of Sports Medicine, their certifications, like the clinical exercise physiologist, if you get that certification, you have to do internship hours, not in just cardiac rehab, but also in a metabolic setting, in a cancer
Hmm.
setting, in a pulmonary setting. So looking into somebody who is a clinical exercise specialist could be more helpful in that way of how to program correctly for someone who, again, like you said, like, I can't do this today. What can I do instead? Or
Right.
even just somebody willing to work with you in
Yeah,
that
I mean,
way too.
there's different variations of what these diseases look like. I have Crohn's disease, and that looks different from another person who has Crohn's disease. And my Crohn's disease in 2015 looked very different than my Crohn's disease in 2017. In 2015, I finished a half Ironman in less than 6 hours. And in 2017, I couldn't run at all because just running across the street would cause so much inflammation in my gut that I would just collapse. So I think that's another, kind of aspect of it. Where am I at today? 2015 Brandy could do an Ironman, not just finish it, but do it quite well. And 2017 Brandy, couldn't run at all. So, just understanding the differences and where your disease is for that moment in time is it's difficult sometimes.
Yeah, and I
Mhm.
think communication too, right? If you do hire a
Mhm.
trainer, whether they are a specialist or not, just communicating that and just saying, I, I, I skipped this workout today because this is what's going on and this is what's
Mhm.
going on, and then hopefully, if that person will then go, okay, let's readdress where you're at this
Mhm.
week. And if they don't do that, then I would highly recommend finding
Somebody
somebody
else.
that will.
Mhm.
So,
Yep.
because again, you have enough stress with everything else and all the other symptoms. It's just important for you to get up and move, whatever that movement is, and to not be judged on the way that you decided to do it.
That's an outstanding point. Not judged by other people, and of course, not judging yourself,
Yeah.
which I know is very difficult for most of us. We always have a vision of where we could be, should be, want to be, and sometimes we need to stop judging ourselves too. All that being said, we've touched a lot on the relationship between exercise and depression and anxiety. I've done quite a few shows recently on mental health. Yesterday, I recorded one, talking about the recent suicide of Twitch boss, you know, because chronically ill patients do have a much higher incidence of depression and anxiety. And I know that I can speak from personal experience. I'm always tackling some level of anxiety in my life, just due to the Crohn's disease, and then of course the drug-induced lupus and other things that I've been through. but exercise can help with both of those things. Um,
Well, we have to also look at, unfortunately, for those with chronic disease, anxiety and depression are another complication. We
mhm,
have to look at it as a medical complication, whereas anxiety and depression in itself is a chronic disease, right? So, again, the thankfully, many years have gone by now that they've been establishing more and more evidence on the fact that exercise can be just like for the physical symptoms, just as effective as mental health symptoms,
mhm,
just as effective as even taking medication. So they've done some studies where if they had depressed individuals, they had them go through an exercise program, a treatment, like a medication, and then a control group. And the treatment, medical medication treatment, and the exercise were almost equal in terms of symptoms decreasing. Again, caveats with that, just based on the severity. If you have somebody who's depressed and suicidal, you're going to do everything you can. So usually you're going to do medication plus hopefully like therapy and exercise treatments and things like that. But if we're looking at more mild depression, we've seen a lot where if we can get people active, it could be just as effective, sometimes even more effective than medication. And then we now know all the medication side effects that go with it. So again, we've talked about all the
mhm.
side effects that you have from your chronic disease medication. Now add in side effects from anxiety and depression
Yes.
medication. So if you can, if possible, trying to do more of a therapy exercise route to your to help with your depression anxiety instead of going on to another medication, I would always recommend that first. I'd always recommend, even for physical, if
Mhm.
somebody's pre-diabetic, pre-hypertensive, try changing some lifestyle modification, do some lifestyle modifications before going on those medications that have those side effects, which then again, right?
Yeah,
It's just ongoing because then you have
or
those other side effects and then you don't feel like good and then your quality of life goes down and then yeah, so it's just an ongoing cycle. The nice thing about when if you exercise again to improve depression or anxiety, just in general, just short, little, easy exercise. And again, I should not even say exercise because people hear exercise and they're like, you're going to make me run and take
mhm.
group fitness classes. And I mean, literally go out for a walk for 20 minutes. That's a mood booster.
Yes.
Okay. Doing something you enjoy. If you enjoy dancing, take a dance class, right? There's many adult dance classes out there now. And again, you don't have to go full on professional ballet. It's something as fun as like a salsa class or, anything that like a swing class, something that you're like, oh, I've always wanted to do that, right? So there are so many fitness opportunities now that picking and choosing, but you really do have to do something you enjoy.
Mhm.
And we were talking about that intensity level too, that a lot of the research has found that in terms of mood, fitness level and the intensity of the exercise is going to matter. So if you are someone who does not have a high fitness level and you go to an intense fitness class, your anxiety will actually go higher
Yeah.
than, and your mood will be not as positive, will be more negative because again, you'll feel like you failed, you feel like this was way too hard. High intensity exercise alone has symptoms of anxiety, like high heart rate and the
Mhm.
sweating, so that can trigger things. So it's actually better to make sure you match the exercise to your fitness level and where you're at and what you enjoy, and then you'll get more mood boost and
Mhm.
relieving those depressive and anxiety symptoms. The other thing is it's something you can have control over, and it's something you can, again, we talked about maybe some of those outcome goals, but we can talk more about like those process goals, right? So it it gives you a sense of accomplishment and a sense of achievement if you make those goals appropriate. And that's why with some of the reasons why they think it helps depression and anxiety, because it gives you something you can control and
Mhm.
it gives you some self of feeling of accomplishment, that even if it's a daily accomplishment of today, just if I got up and did 20 minutes today, I did it,
Hmm.
right?
Yes.
Check the green box, right? So that that is, I think, the most important, especially when we're dealing with a population where you are going to go from feeling great one day and not feeling good the next day.
Hmm.
It's going to be more about building confidence, building accomplishment, and giving you something you control in a disease where you can't control that,
Yes.
right? You can't control how you're going to feel or what your body's going to do next, but you can control how you decide to deal with it that day, right?
Yes.
Whether it's a walk or something else.
Yeah, no, you're right. You're right. Before I was able to exercise again, I just walked the dogs. I was able to walk the dogs. That was the first thing I was able to do coming off of the Humira, and it made the biggest difference in the world and how I felt. Now, for me, I had to go on medication as well. And, based on my experience, I would encourage anybody who's suffering and can't get through to go on the medication. I've been lucky in that Wellbutrin has not given me too many. As a matter of fact, the only side effects it gave me is it made my Crohn's better. And for a solid 2 to 3 weeks, I had a hard time eating. So I actually lost a couple pounds. So it was all positive. But yes, in the meantime, as I tried to kind of dig my way out, it was walking the dogs it was my happy place,
Yeah.
to do
And
it.
the outside thing too. Like if you can do it outside, that actually has even more
Oh,
mood boosting
God.
effects than if you do something inside. So,
Oh, didn't some of us learn that the hard way over this
yeah.
pandemic? I
Yeah.
swore every time we couldn't go outside, I was like, my goodness, I think I'm going to die.
Yeah.
I need
And
sun.
that was probably one of the things that I loved seeing during the pandemic is I just remember seeing everyone in our neighborhood
Outside.
walking, and they're out doing family walks with and on their bikes, and it and me thinking back to that, like I'm thinking just over the past summer and fall, yes, you saw everybody outside, but it wasn't the same. It was just like constant people walking by, and that was amazing. And we need to take that from that we did that because we needed that mood boost. We needed
Yeah.
to be outside. Like we can't go and do these things that we always go. We can't go to the office and stuff. So let's go outside and get some contact or fresh air or whatever it was.
It was
So,
beautiful.
yeah.
So, do you have any tips for people who, we talked about some tips for people who want to start a new exercise routine. Do something you love, make sure it's enjoyable, something you can accomplish. Do you have any other tips for starting one? How do we keep ourselves healthy, not overdo it, not underdo it?
So I'll give you some of like the typical recommendations, and then we can talk about that a little bit. But one of the, and I wanted to point this out because this was really important to me to show you how little you need to do just to improve quality of life. So one of the studies on bone mineral density in Crohn's patients, they had their participants walking 3 times a week for 30 minutes for 3 months, and their quality of life significantly improved.
Mm.
So that's 90 minutes. That's 3 Netflix shows. Even if
Yeah.
you want to watch your Netflix show and walk at the same time, that could even benefit you. Going outside's better, but
Hmm.
if that's what you need to distract, then by all means distract. So I think it's so important to understand that it doesn't have to be a structured exercise program. Physical activity, going outside, even playing with your kids, like we said, going for a walk with your dog, taking a class that you would enjoy that involves movement. Any of that is going to benefit the person. ACSM, that's the American College of Sports Medicine that I mentioned before, they're recommendations that they go through this whole epidemiology type research, and they've done this for years, and they come out and they always revise their guidelines. The last time they revised, I believe, was a couple of years ago, but it's still showing that 150 minutes of moderate intensity cardiovascular exercise will is the recommended amount to
Mhm.
prevent or treat and improve quality of life and health and illnesses and all of that. So, and what do I mean by moderate intensity? That's like a brisk walk. Okay,
Mhm.
it's a light jog. Like if you are running a light jog. If you're cycling, it's just moderate intensity, keeping your heart rate like 40 to 60% of your heart rate max. They do have another option, which again, it depends on the person, but you can also do 75 minutes of high intensity exercise. So if you like doing those HIIT workouts, if you are doing like high intensity interval training like HIIT and doing higher intensity workouts, you only need 75 minutes. But again, based on the person's fitness
Mhm.
level, I don't ever want anyone who's sedentary to be like, I'm going to go do high intensity workouts because
Mhm.
it's not going to go well. Like we were saying, the enjoyment factor is going to help with adherence. Also, when we talk about this 150 minutes, remember you can divide that up any way you want to because that's per week. So if it's a 10-minute walk one day and a 30-minute walk the other day, it doesn't matter.
Mhm.
I'm sure you all saw a lot of news over the past couple of years about just sedentary and sitting at our jobs all day and that mortality risk. So that's kind of how they also revised their recommendations this time around, was the idea that just getting up and moving, right? So just standing throughout the day, moving around throughout the day. So try to think less about being like, I have to do this structured exercise program and I have to do it well. It's more about just getting up and moving and incorporating that into your day, as
Mhm.
opposed to it has to be for this long at this intensity and this effort. So those are like the general stuff, and I can't say it again that behavior change is hard. Anytime you can obtain help from a professional or a specialist in this area, the better you will probably view
Mhm.
the program, even if it's somebody you can just bounce ideas off of, or just make sure again, like, am I doing this the right way? Well, this one didn't feel so good. Am I doing it too hard? Like anybody you can bounce those ideas off of. Anyone who can knows a little bit about how to train somebody who has a chronic disease is even better. So we all know, especially too, that that can cost money, right? And unfortunately, well, again,
It's
that's a whole nother topic of it
yes.
should be covered by insurance. And then that's what I was talking about with that team. Like if we go towards that model, you'd be covered by insurance to have a behavior change coach, and you'd be covered to have an exercise physiologist or a personal trainer. And so I would always encourage somebody, if you can, to again talk with somebody who's a professional, even if it's for a short amount of sessions, so they can just get you started and make sure you're doing it safely, especially if you don't have as much experience in that area. Because again, we think we're like, oh, we got to do it at this effort, and then we hurt or we're sore and then we don't do it, so, or we didn't
Mhm.
like it. Well, I have to be running is the only thing that's going to be work. No, it doesn't have to be running, right? So I think that anytime you can talk to someone, and now you really do, again, you have a lot of options out there. Just make sure you look at the person's background, see, maybe even ask them for referrals or clients that they work with, get an idea of how they coach or they train. Even just, again, finding blogs or finding
Mhm.
podcasts of individuals that you trust to give you some tips. Again, it there's a lot of people out there that say they're experts and they might not necessarily be experts. So just research that. So
Ask
that's, yeah,
questions. Yeah,
yeah.
absolutely. I have to say, one thing I would love to see is exactly what you talked about, and that's an entirely new show. Talking about making exercise and this overall wellness a part of your health insurance plan so that it's covered. I mean, you know much better than I do, just how many chronically ill patients are out there who may be chronically ill because of lifestyle
Yeah.
modifications that could have been
Yeah.
taken. You talk about the amount of heart disease and diabetes,
Yeah.
um,
So,
blood pressure that's in our country right now. And, our first stop was to a nutritionist and an exercise scientist. I think that we would have a very different outcome when it comes to our health.
yeah, cardiovascular disease is still the number one cause of death in our country.
Yes.
And obesity is still, it's overweight is 60% and obesity is 30% of the US. So, and a lot of that, not all of it, because there can be genetics and hormones and again, complications from other things, but there's a good chunk of that that is a lifestyle
There is. I would actually love to
issue.
do another episode with you talking about those lifestyle
Yeah.
modifications because it also helps those of us suffering from other types of illnesses. I have a lot of pain in my joints and in my bones, and it has been emphasized to me over and over and over again that weight maintenance is one of the top ways to try to alleviate some of that pain. Because the more you weigh, the more it's just weighing down on you. And I'll be the first to admit, Americans, my goodness, I remember the wine glasses at my grandmother's house, and I would think they were thimbles now. I'm
Yeah.
like, what is this little thing? Because you come to my house, you're getting this goblet that's two-handed, and that's how we've come to live our lives, and we all of us chronically ill, not chronically ill, could be chronically ill. We need to have better discussions. So that's another
It's a
story.
whole
That's
nother
a whole
It
nother
really is.
and we're gonna have to bring in everybody, because I'm
Yes.
young, we're
Yeah,
all,
you need a panel on that one.
yeah, all the people, all the people. But I will contend, as we talk about this, yes, weight maintenance is part of it too. Um, well, thank you very much. Today we were speaking with Dr. Debra Stroiney, Associate Professor, Exercise Science. This has been very helpful. I always ask people who are chronically ill, what do you wish you knew when you were first diagnosed? And, there's so much I wish I had known. One of them being that my whole exercise life was not over. It was just going to look different and it was going to evolve. And I think that your points on meeting yourself where you are probably one of the most important things to remember
Yeah.
as a chronically ill patient, especially when you're first diagnosed, because it's a hard lesson learned. Well, thank you so much for joining us today, and we're going to start working on that next
We
episode.
are. We have to.
Thank you
All
so much.
right. Thank you.